So our final presentation this morning will be on climate change, and our speaker is Dr. Jonathan Patz. Dr. Patz is a professor Dr. Patz is a professor and John P. Holton Chair in Health and the Environment of the University of Wisconsin-Madison, where he also directs the Global Health Institute. Dr. Patz co-chaired the health expert panel of the first congressionally mandated U.S. National Assessment on Climate Change and was a convening lead author for the International Millennium Ecosystem Assessment. For 14 years, Dr. Patz was a lead author for the United Nations Intergovernmental Panel on Climate Change and a co-recipient of the 2007 Nobel Peace Prize. From 2006 to 2010, Dr. Patz served as founding president of the International Association for Ecology and Health. Dr. Patz received the American Public Health Association Homer Calver Award for Environmental Health Leadership in 2015 and the 2017 Alumni Special Recognition Award from Case Western School of Medicine. He's written nearly 100 peer-reviewed papers, plus multiple reports, 2 co-edited textbooks, and an encyclopedia on global environmental health. Dr. Patz's talk is entitled, "The Heat is On, Why Climate Change Advocacy is Essential to Child Health." Please join me in welcoming Dr. Patz.
Thank you, Eileen. That's a wonderful introduction, and I want to talk to you today about why climate change is really an important issue for pediatricians and why it's so essential that we consider climate change when we consider child health. This is a map that you should understand, and you've probably seen it before. This is the projection of climate warming for the world. On the left, you can see about 1 degree centigrade warming, and on the right, 7 degrees centigrade warming for the Earth. Which one are we heading for right now with our current energy policies? It's the dark red. So we're heading towards that future. And it's not your imagination that summers are getting hotter. This is from a leading climate scientist in the United States, James Hansen, and you can see what summers look like in the 1950s to 1980 range, a little bit later, and now. So this is actual measured temperatures in the northern hemisphere. Our group has looked at temperatures for the United States, and for the cities that we've studied in the eastern United States, most all of them will triple in their number of days that are hotter than 90 degrees Fahrenheit. New York City will go from 13 days greater than 90 to 39 days greater than 90 by mid-century, 40 years from now. I woke up this morning to some news. I heard the news reporters talking about 3 new hurricanes, a triple threat today, and of course that follows the record-breaking Hurricane Irma, and before that, Harvey. I didn't hear the meteorologists talking about the news under those hurricanes, which is, it's sort of, duh. The Atlantic is a lot warmer than usual, and duh, that the strength of hurricane winds increases exactly in step with the sea surface temperatures. So this is something that you don't hear in the news, but you should, is the why we're having such strong hurricanes. Sea surface temperatures drive hurricane strength, the power dissipation index. So I've been working on this for a long time, and one of the reasons that I think climate change poses our greatest public health threat is that there are so many exposure pathways through which climate change affects our health. You can see from the top heat waves, air pollution from effects on ground level smog, ozone, and aeroallergens, vector-borne diseases, waterborne diseases. If we're thinking about climate change, it's not just temperature rise, but it's extremes of the hydrologic cycle, more floods and droughts. And that will also affect water resources and food supplies. And these storms that we're having, of course, leads to population dislocation and mental health, post-traumatic stress syndrome, and environmental refugees. And if you think about, oh, whoops, a new one just popped up. Preeclampsia and hypertension in East Asia. Sea level rise, storm surge, salination of freshwater aquifers. We're actually seeing a rise of preeclampsia in these regions. So there are so many ways through which climate affects our health. And if you think about all of those, a big vulnerable population is children. The heat waves, it's the elderly at most risk, but everything else there, it's children. In fact, the World Health Organization finds children to be the most affected by climate change. They estimate 88% of disease burden attributed to climate change affects children under 5 years of age. It's not a surprise when you look at something like malnutrition. This is looking at actually a map of future summers. And what you're seeing is mid-century on top and towards the end of this century on the bottom. Let's focus on the bottom one. Everything in red, in the dark red color, has a 90% or better probability of experiencing a record summer temperature. Summer temperatures hotter than they've ever experienced. Well, especially in the tropics when you're growing food within a certain climatic envelope, that actually puts a stress on food crops. And it's estimated from this Stanford crop modeler, Roz Naylor, that today's 900 million people at risk for hunger could double by mid-century. That for sure is a pediatric problem. Oh, there's some other news about food insecurity. You've probably heard about the CO2 effect, that more CO2 can actually make some plants grow better. Well, unfortunately, you could have bigger leaves, but you have a deficit in protein. And there's ongoing, this was just published, came out in Politico last week about this scientist who's been working on this for decades, showing a reduction in protein content of crops because of CO2. Another problem as far as protein malnutrition in children. But some plants will benefit even more from CO2. Ragweed. Ragweed loves CO2. There have been some experiments all over the country, actually. They started in Baltimore, comparing potted ragweed plants in the Inner Harbor, where you had warmer temperatures and more CO2 from the traffic, comparing to the rural areas. Guess what? Warmer temperatures and CO2 cause ragweed to produce more pollen. And if you look at the United States, ragweed season, this is published in the National Academy of Sciences recently, that trending with warmer temperatures in the United States, we are seeing longer ragweed seasons. You can see, lengthening, especially at higher latitudes, up to 20 days longer ragweed pollen season. This is a problem for anyone with asthma, and of course, lots of children have asthma. Another group of diseases that are sensitive to climate are insect-borne diseases. This is a picture of Aedes aegypti mosquito. This mosquito carries dengue fever, yellow fever, and Zika virus. So can we ask ourselves, why did Zika emerge and come onto the scene in such a big way in Latin America and South America 2 years ago? Well, it's a complicated story, and it involves international travel and where the Zika virus came from. But one question we have is, what were the climatic conditions right before Zika erupted in Brazil. And you can see here a series of pictures looking at the surface temperatures during that El Nino. And you can see at the bottom that Brazil, Colombia, the countries most affected by Zika, they're having record temperatures. We've actually done the analysis. These temperatures were 4 to 5 times standard deviations higher than a 50-year average temperature. So it was extremely hot. Well, from what we know about the relationship of Aedes aegypti mosquito and temperature, you can have what's called vectorial capacity, the ability to transmit virus. And this group that published also in the National Proceedings of the National Academy of Sciences showed the capacity of this mosquito to transmit Zika and dengue to be the highest level in the last 60 years. So the climatic conditions made Zika transmission extremely suitable. Even though climate is not the full story of Zika, it is a majorly enabling story. And when you see studies like this, that the ecology was such that the temperature probably had some contribution to this, it makes you wonder how important, how these are going to be changing even in the future. So I want to remind you, it's not global warming. In fact, I don't even call it climate change. It's the global climate crisis, and it involves temperatures, sea level rise because of thermo-expansion of salt water and land-based glaciers melting. But it is also about precipitation. And we're talking about the extremes which matter. Not a lot of precipitation and drought. Too much precipitation, contamination, and flooding. And this is looking at the type of precipitation we're expected to see in the future. This is a global average, and what you can see is that it's the heavy downpour events that will be increasing. So in the future, when it rains, it will pour. Is that a problem for health? You bet it is. We're here in Chicago. We actually studied the Chicago water basin, and in our analysis, because of the increasing heavy rainfall event, the number of combined sewage overflow events will double for Chicago. This is a problem for all of our health, but for children, take a look at this picture of Milwaukee after a heavy rainstorm. Dr. Sandra McClellan from the Great Lakes Water Institute goes out in her NOAA research boat, and she dips for E. coli and samples. And look at these two beaches, Bradford Beach and South Shore Beach. They light up with lots of E. coli after a storm. Children swim in water. This is a risk, a recreational exposure risk to children if they're swimming on a beach after a heavy rainstorm. We've actually done studies in Wisconsin showing that childhood acute gastrointestinal disease is linked with heavy precipitation. For municipalities that take groundwater for their supply and they don't treat it, look at the relationship between the risk of AGI and precipitation. So heavy rainfall, contamination, this is a risk to children. I have to give you some good news. The good news is we are at a different time in our recognition that climate change is real, it's dangerous, and the world needs to come together and do something about it. This was the 21st Conference of the Parties that happened in Paris at the end of 2015. It was a monumental meeting. It had 143 heads of state, a record number of heads of state ever gathered at one time in one place. And the agreement, the Paris Climate Agreement, was a very important step forward. Industry was there. This is a major advance as far as where we're going with climate change. And from the health point of view, there are enormous opportunities when you think about getting to a low carbon economy and having clean energy and better air quality. That's a big plus. I'm going to skip food systems, but eating lower on the food chain is a big plus for the environment and for our health. Skipping that for time reasons. But I'll also talk at the end about transportation. And Dr. Gortmaker in the beginning talked about obesity, the obesity epidemic, and why 60% of Americans that don't meet minimum level of exercise, according to the CDC, why this is a golden opportunity to build cities for people rather than for just the automobile, and it will improve our health. So the first one, air pollution. 7 million people die prematurely every year from air pollution, according to the World Health Organization. And indoor air pollution is especially important as far as childhood exposure. So here's an enormous benefit to get to a low carbon energy source, getting off of coal and off of oil and off of dirty cook stoves. What will it cost, though, for clean energy technology? Well, some people argue it might cost up to $30 to remove a ton of CO2. But when you burn fossil fuels that create CO2 and other greenhouse gas emissions, you also produce PM 2.5 and other dangerous pollutants, such that if you were to remove a ton of CO2, you would also eliminate all those other pollutants and save $200 in avoided mortality and health costs, especially from reducing PM 2.5 that happens when you burn coal and oil. Okay, I want you all to sit down. Oh, you're already sitting. Tell your decision makers to sit down. Ask them this question: which number is bigger? And so this is extremely important to communicate. And as our first speaker talked about, communicating the cost and the cost savings to getting to a low carbon economy, it is enormous what the health benefits will be, and especially even in more polluted countries, even bigger. It's not rocket science. I mean, look what we did when we were preparing for the Olympics in Atlanta in 1996. The mayor said, we've got to clean up our air for the athletes. Let's have regulations and eliminate, reduce traffic. Traffic fell by 23%. No surprise. Pollution dropped. Ozone levels dropped 28%. Was there effect on child health? You bet there was. Asthma-related ER visits by children decreased 42%. And these were epidemiologists. There was no change in the non-asthma causes. So it wasn't that people weren't driving to the emergency room. This is a real benefit. It's obvious. Clean up the air quality, and it's better for human health. So I finally want to wrap up and talk about this other aspect, which is, here's the trends in obesity around the world. This just was published last year, showing that everywhere in the world, the obesity trends are upward. And if we think about how to prevent obesity and chronic disease related to obesity, look at this observation comparing American cities. The cities with the highest rates of walking and cycling to work have obesity rates 20% lower and diabetes rates 23% lower compared to US cities with the lowest rates of walking and cycling. So active transportation, it's clearly beneficial. It's not a surprise. But can we really convince decision makers how important it is? So my group at the University of Wisconsin in Madison, we are taking these well-established links between increased exercise and health improvement. And you can see here from this graph, as you increase the physical activity, an MET, that means metabolic equivalent per task. So if you can increase the amount of physical activity per week, look at the risk reduction that you have in especially cardiovascular disease, diabetes, dementia, colon cancer, depression, breast cancer. We know exercise is so important for our health. So now we're trying to actually crank out the numbers and make it real for policymakers. A few years ago, we studied what would happen if vehicle miles travel, just short car trips, in 11 large cities in the upper Midwest. If we could reduce the short trips, what would happen with air quality? And if some of those trips could be done on a bicycle, physical fitness. We found that actually it was more than 1,200 lives would be saved, and also included with the air quality improvement, 2,500 asthma emissions avoided from simply getting cars off the road. So swapping tailpipes for pedals, small changes could pay huge dividends for public health and the economy. And this starts with children. And overweight children often become overweight adults. This is where intervention in children is so critical, a golden opportunity here. So I want to wrap up and ask, is anyone against healthy places and children? And if you tick off these benefits, green jobs, livable cities, clean water, clean air, healthy children, and you can see the climate skeptic is saying, what if climate change is a big hoax and we create a better world for nothing? And it's why pediatricians are essential for communicating that action on climate is action for health. Thank you very much.